How you move is going to impact how you feel. When we think about movement, we want to make sure that we are performing skilled movement appropriately. Our joints, we want to know that we have good range of motion through our joints and appropriate range of motion through the joints for the movement we are about to do. So what happens if we don't have good range of motion? Well, this is going to affect how our tissues are sliding and gliding. Good and appropriate sliding and gliding of tissues are imperative for good movement and feeling better in our bodies. When we have tissue restriction or adhesions, this is going to create pulling, tension, and even pain in our body. Examples such as surgery. Cutting into the skin or anywhere on the body is more than just the superficial scar. We need to think that there are scarring deep down, sometimes all the way down to the bone. That scarring creates a puckering. It is a change in the type of collagen that is laid down, and there is a restriction in the movement there. That restriction not only affects the sliding and gliding of tissues in the immediate area, but also in the chain up the body and below. We've seen in cadavers that you can pull on a scar and that will pull on systems and chains higher or lower in the body that are away from that scar. Other reasons for restrictions could be from disease, arthritis in a joint, injury to a joint, injury to soft tissue. All of these things can create inflammation or scar tissue, which changes how the tissue can slide or glide due to the change of the environment of that tissue. Take, for example, someone who has a tendonitis, and this can be anywhere on the body. A tendonitis is started because there's inappropriate forces from the muscle that go into the tendon. Now, those inappropriate forces can also be pulling from the fascia itself, from the muscle that is adjacent. I'll give you an example. So if we have a bicep tendon and there's a restriction somewhere in the shoulder or in the upper trap, the muscles that are adjacent or in line with the bicep can actually start creating that bicep tendonitis due to how the tension and forces are dispersed. Our tissues respond well to pressure. So placing pressure on the area can help alleviate this pain. For example, rolling out. There was a study that I came across in my readings which looked at the impact of cyclical tension versus continuous tension on fibroblasts. And what it showed was that in the fibroblasts that had cyclical tension, so that's tension and then relax, there was an increase in production of collagenase, which is the enzyme that breaks down collagen, versus the group of fibroblasts that just had constant tension. So that could be akin to lifting a load, cyclical tension versus a constant stretch or chronic tension. Our bodies are going to improve the sliding and gliding of tissues when we have various loads and tensions going through those tissues. Our tissues are able to withstand load placed on it due to having this collagenase and tissue turnover. It is essential in the body, especially for wound or injury repair and for recovering after loaded exercise. So we know that our body responds to pressure. Rolling out is very good. Cyclical tension, lifting loads, is going to help impact our tissues in a positive way. But I did describe that is very important for those loads to be lifted well. Good technical skill is essential to make sure that our bodies are moving in the most optimal way possible in order to prevent these tissue tensions from occurring, which can prevent more pain. Finally, new mechanical stimulus are necessary in order for our bodies to respond to that stimulus. That means if we're doing the same thing, we're not maintaining. Side note, there's no such thing as maintenance. You're either building or you're losing. So what are you doing to progress your exercise regime and what you're doing in order to continue placing new loads on your body to keep that good sliding and gliding of tissues? Considering how we can add progressive loads to our tissue can help how you move, how you feel on a day-to-day basis, and can also keep some of that pain at bay.